And welcome back. Joining us for our second conversation for today are Dr. Carissa Etienne, who is the Director of PAHO, and Dr. Ramon Figuerora, who is the CEO of the Ministry of Health, to talk to us about the signing of the country cooperation strategy for 2017-2021. Good morning. Thank you for being here.
Good morning.
Good morning.
Thanks for having us.
So the cooperation strategy, it's a new initiative. It's for this year. Tell us a little bit about the working up towards this strategy.
Well, the country cooperation strategy is a mechanism that the Pan American Health Organization uses with every member state. It is consistent with the National Development Plan for Health, but also it's related to our strategic plan 2014-2019, covers a period of 4 to 5 years, and we develop it in consultation with not just the government, but also civil society, private sector, to arrive at what are some of the most important priorities that the country has. And it is an agreement, a compact, between the Pan American Health Organization and the member state as to what is the technical cooperation that we are going to deliver over the next 4 to 5 years.
Now, Dr. Etienne, one of the benefits of having you in country is being able to have you access directly health officials, government officials, private sector entities, to really have an on-the-ground experience as to what the priorities are and should be in the country. What has been your general sentiment so far in terms of these interactions, and how does it differ from what you are seeing in the landscape in the rest of the Caribbean?
Good. So I've had the opportunity on this visit, as you've mentioned, to speak and to have discussions with the Prime Minister, with many of the governmental sectors, including their CEOs and their ministers, but also to have discussions with senior health officials and to visit some health facilities. And we visited Inspiration Center and had discussions with them there. And importantly, we met with the UN country team, all of the other UN colleagues. From what I have seen, from the discussions that I have held, I think that Belize is well on its way to universal health coverage, which is one of the highest objectives that we have in this region. I've seen the immunization program, which is very well organized with very good results. They obtain more than 95% coverage for all of the antigens. I have spoken to the Prime Minister about chronic diseases particularly, and how he can create the enabling environment to allow people to lead healthier lives. So we spoke about taxes on alcohol and tobacco and sugary beverages, which is happening in some of the countries. And we also stressed with the other sectors the multi-sectoral approach that is so important for the sustainable development agenda, but also for the health agenda. We recognize that we can't be successful if people don't have access to nutrition and to water and sanitation and to education and to healthy housing, to work, etc. So we believe that it is this multi-sectoral approach that is going to get not only health and well-being, but the overall development of this country.
May I just quickly jump in here, because I think one of the highlights of Dr. Etienne's visit, or when we heard that Dr. Etienne was visiting, we said we need to maximize on her presence here. And it was actually to strengthen the pitch that we're making to the other sectors in government, to education, to agriculture, as Dr. Etienne was saying. Among our priorities, as you all know, are the chronic non-communicable diseases. And if we're to make a significant impact in changing the trends that we're seeing in time, we have to work with other sectors. And actually, it's more important what the other sectors can do for us than what we can do in terms of curbing the trends that we're seeing. And I think Dr. Etienne's presence and the pitch and the message to the other sectors, I think, was valuable in assisting us.
And I'm glad that you brought that up, because that was one of the areas I wanted us to explore first. How do you build the connection? We know that the funding for the health ministry is one that people look at, and perhaps they don't recognize it can be prevented. The amount of time people have to spend in the hospital, the amount of access they need to have, the challenges we're seeing specifically with NCDs and the burden there can be prevented before through other ministries. So how do you tie it all together? When you talk about a multi-sectoral approach, you're talking about agriculture and you're talking about education, and I'd love to hear in terms of labor. How do you build the connection for people to really be able to understand that it isn't a health problem, it's a collective problem?
So this is really an excellent question, because governments, not just in this country, but throughout the region, if not globally, but even us at PAHO, this is a question that we are struggling with. How? What we have is piecemeal approaches. But if you take, for instance, NCDs, we know that you need to reduce smoking, so we need the legislation. We need to ensure that we are not selling tobacco to school children. We need to ensure that trade becomes involved in terms of the labeling, and we have to ensure that we have the laws that will support all of this. And the same thing for alcohol. We have to enforce drink driving. We have to enforce the regulations about selling alcohol to children. The media has to be involved. We have to begin refusing the sponsorships from alcohol and tobacco, sponsorships for sports group, etc. I think the Minister of Agriculture yesterday made a very important point. Belize produces all of the fruits and vegetables that it needs, but people don't necessarily eat it, And so he said, before we said an apple a day keeps the doctor away, we need to change that slogan and say what a fruit a day keeps the doctor away, and to encourage people to eat the fruits that they have, encourage increased production of fruits and vegetables. So in a way, as you said, it is joined up. And that's why we called them together. And they admitted that they were doing multi-sectoral initiatives. They recognized the need for greater institutionalization of it. And when I go to countries, I tell the Prime Minister, sir, it's only, or ma'am, it's only you that can lead those multi-sectoral responses that are going to be successful. Else it's voluntary. Agriculture see it voluntary to work with health. They don't see it as their prime business, And so, but it is difficult.
Yeah. The other thing that I think needs to be mentioned here, though, is also the initiative in Health in All Policies, which is initiative I think was endorsed by the WHO, PAHO, where in anything that all the other sectors are doing, they need to consider the health aspects of it. And so we're trying to also promote the health in all policies. But at the end of the day, Marlene, I think it is a mindset. It is something that doesn't change overnight. And I've seen it. I've been in the health system for quite a long time. I think we've made some progress. But I think changing the mindset for people to understand that health is not only, when we talk about health, we talk about sickness. When once they label it health, they say, oh, that's a ministerial health problem. Really, we need to change that mindset. We need to have people thinking that education is part of health. When you're doing education in schools, you're preparing people to lead healthy lifestyles, to understand what are the determinants of health, and to avoid the risky behaviors that people engage in. Drinking, tobacco, as Dr. Etienne mentioned.
And a nutritious diet.
Right, a nutritious diet. And then the state has a responsibility to not only talk about nutritious diet, but make it available. So we can't talk about, kids need to have good nutrition. We need to make it available.
And affordable.
And affordable. Exactly. So we have a slogan that says health is everybody's business. And whether you're private sector or public sector or all of government, health is everybody's business, families, individuals.
I made the little point of saying labor for the simple fact that I think oftentimes one of the connections that to me is easier to tie together, but we don't always look at, is just the productivity of our workforce and the amount of time that people spend dealing with whatever condition they're battling, diabetes, hypertension, if they need to perhaps take time out to be able to recover from any one of these issues. it is taking away from your productivity.
Exactly.
So in looking at how you can be able, and especially speaking of NCDs, sedentary lifestyle, diet changes, there are many areas where these messages can be introduced. And I've always felt that perhaps if we look in the workforce, that's one area. If your employer says, okay, you kind of should get time off to go to the gym and exercise, or to walk around the building if that's easier. Is this type of mentality, are these initiatives happening anywhere else? And what's the sense of it here in Belize?
Well, I don't know about Belize, but I know, like in some instances, like Japan, that there is a mandatory period where they stop and everybody does exercises. I think that given the prevalence of chronic diseases, I mean, somewhere between 40 to 70% of all of our deaths in the Caribbean are due to chronic diseases. I think it should become, the prevention should become very much a fabric of everything that we do. Yeah. We have schools, and those are that's a captive population. But what we do is see that physical activity disappears from the curriculum. And even when it's on the curriculum, after you get to stage 3 or stage 4, nobody exercises again. So we have to make sure that that is, firmly embedded in there. And the same thing for our work population. Our work population is captive for a certain time. And the employers need to begin to see that a healthy workforce is a more productive workforce. So in fact, it is contributing to productivity if you ensure that your employees have access to exercise and exercise facility, that you give them the health education that is necessary so they can eat healthy and all of this. But it's a mindset as well. But it's a mindset that we must overcome, because our people are dying, and they're dying at a younger and younger age group, particularly from those health behavior related issues.
And not just dying, the quality of life they have.
Yeah, exactly.
In terms of the local front in...
Well, to start off, Dr. Etienne is right. I mean, in Belize, about 40% of deaths are caused by chronic non-communicable disease and injuries. Well, if you add injuries to it, it's probably almost like 50% of our deaths. 5 causes, killing 50%, responsible for 50% of our deaths. And a lot of it is preventable. What we're trying to do is, at least from the Ministry of Health perspective, we've been trying to promote, lead by example. So we start trying to promote within the Ministry of Health physical activity, and when we have meetings, promote healthy food. Because before we used to, you come to a meeting and it's cake, everything that you shouldn't eat. So we're trying to promote healthy snacks and then exercise. So we're trying to get and then extend to all of government sectors, to other ministries as well, so that we can have that kind of initiative and then expand probably to the private sector. But we need to lead by example. And I always believe that if you talk about the things that people need to do, you need to do it yourself and lead by example. So it's a gradual process. I hope that eventually we can expand to all. We've tried these initiatives, before at Social Security. I think we had that kind of activity, physical activity in the institution, and I think it didn't quite catch, but we need to keep trying.
It's very interesting, because as I'm hearing everybody talk, it's just coming to the forefront of my mind, where do you start? Because this is all nice and beautiful to have everything on paper, to start at the policy making level. But for the layman on the street, the person who is used to their diet, who is used to their routine, who knows that their employer has no regard for their health themselves, why should they buy into something like this? I think that for a lot of people, the visibility of the impact things like diabetes and other diseases that are very prevalent in our country, the visibility of it isn't as clear as we think, because for them, I have it and maybe my cousin has it, but they don't understand how it impacts not only them, but the wider population, the entire Caribbean. You mentioned 40 to 70% of deaths relating to these kind of diseases. So I'm thinking, in terms of the average man, where do you start with them?
So congratulations, because this is exactly what we need to start doing. We need to start bringing it to the attention of the public on all fronts. I think within communities, in churches, on the radio, on the television, we need to. Our heads of states, heads of governments in the Caribbean, they ask for a public awareness campaign. And we are beginning to work on this. But it has to be sustained, because we need to begin in the schools. I mean, it's easy to begin in the schools, so low-hanging fruit for us.
Yeah.
We need to impress upon the private sector so they can begin in the workplaces. We need, through women's groups, etc., we need to promote those. And it's every sector, it's what we are doing, the advocacy for every sector, it's the health in all policies that we are saying you can do something. And what I need to say too, it's not just the agricultural or the education sector focusing on health, but it's also for health to say that I know that when your girls are educated, I will improve child health. So it's also health to say, how can I help you in education to ensure that you enroll, girls are going to school, that girls are learning, and that you are putting some health messages and education in your curriculum.
Mm-hmm.
You remind me of something that I wanted to say before as well. One of the things that I think over time I've realized is that education is not just telling people what to do. We need to learn from the private sector how they sell their products. They can sell you bad things and you think you get something good.
Marketing.
We need marketing. So that's the point. We're getting into a social market.
In the places of the world, Coca-Cola.
We need to start doing I don't call it health education, it's a social marketing campaign. And we are in the planning stages to try to organize a social marketing that is sustainable. And I agree, it can't be a one-time thing. It has to be over. We have to invest in that.
Yeah.
And people need to understand that's a good investment. You will see the returns over time.
Yeah.
And when you do social marketing, you look at the different segments of your population. You look at the man in the front. What is his mindset? What will he understand? What will she understand?
How will you change their behavior?
Correct. Yeah. And that is what we need to learn. And so we need to get that expertise to help us package wellness and sell it to the population, to the different segments of and we can't expect overnight to get results. It's going to be over. I think if we were to invest, if they asked me where to invest the most money right now, I would do it in a social marketing national campaign.
One of the things
and someone who works with communication, I agree.
Yeah, exactly.
It's unlearning and then relearning the new path.
One of the methods that we learned in my own country is that the persons who know more about the subject are the least able to promote this behavior change. Actually, what we did was to work with community members and community leaders, and they went around to educate their own community members and to change their behavior. When the knowledge is right there in the community, they can sustain it.
Yeah.
And they use various methodologies. One of them, they use popular theater and song, and they were able to do it very well.
I love this aspect of the conversation, but I do want us to move on to another issue, which is also very important, and that's the universal health care services. And you spoke about a willingness and a recognition of the necessity of having universal access. And Dr. Figueroa, I suppose you can brief us on looking at the full rollout of NHI, which even with your social security background, we know has been something that's been a part of the conversation for a very long time. It has been benefiting those who have access and expanded incrementally over the years. But what are the I'm sure you heard a part of the conversation. We're talking about the economy and the issues with finances. How realistic is it that we will in the near future?
All right. I'll take you back to the conversation we had when we introduced the national strategic plan, which has within it and it's aligned with what PAHO and WHO are talking about in terms of universal health coverage. So from then on, we were structuring, planning how best we could reorganize ourselves to meet the overall goals of universal health coverage. In terms of national health insurance, I think, and from a personal perspective, I know that the general populace and our leaders are in a corner in terms of finding additional resources. I believe that there is enough space, fiscal space, to collect, I don't want to say tax, but to collect a contribution that can be reinvested in health. Now, from all our surveys that we've done in NHI, we've asked people, are you willing to pay for it? And people are saying, if I'm getting this kind of service, I'm willing to pay. But I need it not to go into general revenue. I want it to go into health. And there is where with economists, we're having a bit of a discussion, because economists and financiers don't like to have a separate fund. They want it to go into general revenue. And so that's
they
a
want
discussion.
you to trust that it will eventually go there.
And I say there's enough fiscal space, because we're looking, when we look at our information on what people pay out of pocket already for healthcare, there's in Belize we have out of pocket expenditure about 30%. I know in the stats it was like 20, but we actually I think the last survey we did with health economists was about 30%, which is too high. It creates a barrier to accessing healthcare. So people are spending out of pocket. I think it can be spent much more efficiently if we would take that contribution, put it into a health fund, and then expand the national health insurance. We're also discussing, and it probably can't be one single source of funding. It might be that one. Maybe we can tap into Social Security. There's different options. And I think next week we're having a forum supported by the Pan American Health Organization with experts from Washington coming down to analyze what we are doing, what we have, what we want to do, see how we can tweak it, and then look at the issue of financial sustainability. Because for me, at this point in time, what is stopping us is the sustainable financing, bless you, sustainable financing for us to be able to roll out. Government has given us, to this point, we've been able to continue with because government has given from general revenue about $15 to $16 million to NHI, and would continue to provide that. But we feel that for it to be sustainable, it has to be an additional contribution. And we need to have that discussion with our policymakers and convince that it's a worthwhile investment, that it can be done, and what would be the modalities.
In keeping with that conversation, I'd like to jump in as it relates to the access to services on the personnel level, the human resources, the amount of doctors we have and nurses we have. I know right now we have an influx of Cuban doctors, and the general consensus with many people is that they're not satisfied with the quality of service, not just the actual providing of the services, but the way that it is even delivered. Like, you go to the hospital late at night, you're sick, obviously, because I don't think anybody goes to the hospital just for the snack bar. And the nurses, they treat you horribly. The doctors treat you like another patient, and not like a patient that they need to deal with. From that standpoint, and even the amount of specialists we have in our country, is there anything within the cooperation strategy that addresses that issue with quality?
Within cooperation strategy, one of the priority areas is human resources and health. That's, I think, the second priority in the document. But you are absolutely right, and that's one of our, what should I say, with the Director of Health Service, we always sit down and discuss this. That's one of the biggest headache, human resource management. Because when you're talking about quality, people want to equate quality with only the technical quality, with how you do. But that's not a big portion of the quality is the humanness and the sensitivity that you provide. And day in and day out, we have complaints from people of exactly that.
Yeah.
You know, they don't complain about the service, the outcome. They complain about the way they were treated. And sometimes even if it's a negative outcome, they would be able to live with that if we could sit with them and explain and be human beings.
Yeah.
Just basic human beings, treat them like human beings. And that's a cultural, we need to change the organizational culture within and I'm talking about the Ministry of Health. We need to change that culture. And we're trying to see how we can, we continue. It's not an overnight thing. I don't think it has to do necessarily only with the Cuban coming in.
Yeah.
It's done by our own Belizean nurses and doctors sometimes.
But just, I mean, I think we have to be careful here. Frankly, the reports that we get from many other countries in terms of the Cuban medical personnel, that they are very, very friendly, that they engage the population. In fact, in Brazil, where we have 12,000 Cuban doctors working in the first level of care, they go to the remotest of areas where nobody goes to. And you know, the prime minister, the past prime minister, president of Brazil, she said people are saying they touch us, they listen to us. So I think we don't want to have that.
No. And I was going to jump in there. I think a part of it that we have heard is more the language barrier, which doesn't really allow for people to understand the type of treatment. And there are other non-nationals who work in the hospitals from various countries. So I don't think it's one specific country that we're talking about. But, you know, Dr. Figueroa, what you point out in terms of looking at quality of healthcare is I think definitely one of the foundation, the issues that has to be addressed. But then you also look at the institutional part of it. I mean, so many of these issues are cross-cutting and have so many different implications. So if you're talking about rolling out NHI countrywide, for example, even at a cost, and you're talking about the quality of the care, is it also looking at expanding the number of personnel that will be available? In other words, if I am an overburdened nurse who hasn't gotten a break in a long time, whether I'm from Belize, Philippines, Nigeria, or Cuba, my empathy towards another person can only be stretched so far. So is that also, when you talk about training and quality care, is it also looking at improving upon personnel?
Well, the human resource shortage, I think, is a thing that it's across the region. All countries are facing that issue. But yes, as I said, one of our priority areas in the strategic plan, our national strategic plan, is human resource development in health. Doing a proper planning, doing projections, and doing proper training ahead of time. The bringing in resources from other countries is just a part-time measure to fill in the gaps. In fact, with physicians, the more physicians were getting back into the country from Belize, then we reduce the reliance or dependence on other countries. But in particular, nursing is a big issue. With the National Health Insurance Scheme, the model that we're implementing, actually one of the advantages is that it gives you a ratio per population that needs to be met. So we need to have enough resources to cover. The unfortunate side of it is that as the population grows, and as we also have migrant population, because that's another issue that we are having, particularly in the south, where we're having a lot of migrants. And regardless whether they're migrants, they have a need, and we have to meet that need. That places a large burden, and then we need to find out how to expand. I think that's one of the considerations in looking forward. How do we make the model a bit more flexible to allow for expansion of the human resource depending on the needs and the population growth? Right now it's a little bit rigid, and we're not able to expand, and so we've come to a point where even in our National Health Insurance contracted clinics, it's already overburdened.
May I add to this? Because I think it goes just beyond numbers. It has to also do with distribution of your healthcare workers. It has to do also with how your health systems and services are organized. If you do not strengthen your first level of care, your primary care, then more and more people are shunting and going directly to the hospital and placing really an inordinate burden on your hospital services. What in PAHO, what we advocate for is ensuring that services are available in the periphery at the first level of care. It is cheaper to treat somebody in the first level of care and to prevent their illness.
And secondary tertiary.
Exactly.
Yeah. And I'm so grateful. I mean, it's interesting because you're speaking about Cuba and they have a great model for that in the first place. But I want to keep the conversation going just in the interest of time, and I think health financing is a very fascinating topic that we've seen included. I'm very interested in hearing, in terms of your visit and your conversations and the strategy itself, what are we talking about finding sources of financing for healthcare?
Okay, so I spoke at a dialogue on Monday night. So for improving financing for health, we speak about a few things.
Yeah.
One of them is, first and foremost, payment at point of service is the worst way to finance your health system.
The worst.
Worse, because what we are doing is creating barriers for poor people. So we say that government needs to increase their domestic investments for health.
Okay.
Then they need to be at a minimum 6% of our GDP, so that's important. We think also that we need to create these financing pools where solidarity and equity principles are part of it. We don't believe in that you need to have several pools. We believe you have to have one pool, that the private sector, Social Security, NIH, and government contribute to this pool of resources, because you can do so much more if that happens. And we also say that you need to improve the quality of the first level of care, of quality of service, because that reduces costs. We say that they need to begin to look at inefficiencies, because there are many inefficiencies in the system that can be corrected, and this is a no cost way. And we also advocate for other innovative financing. So maybe the sin taxes, the taxes on alcohol and tobacco and sugary drinks, and how the government ensures that that goes back to health. But government can do other things. They can tax goods coming in. You can do tax, I don't know if you want to do travel here because it's already quite high, but you can do taxation. You can put a 1% on all travel. So there are various
But your fundamental point is that whatever additional source of finance you find, you'd want it directly earmarked for health services.
Certainly in the pool.
And that is the direction that you're hoping to go. You were able to sit down with the Prime Minister and the Minister of Health and other ministers. How receptive were they to this idea?
I think sufficient.
Okay.
Obviously, a Minister of Finance and a Prime Minister, they are competing priorities.
Yeah.
But what I found was the willingness to look at health as a priority, the willingness to see how they can increase domestic investment. And we are not saying a one shot. What we are saying that you must incrementally increase, as you go along. But even looking at Belize, you are what, 5.4% already, and a good percentage of that is public financing, no?
3.4% of GDP is public financing.
Yeah.
Now, let's touch on the topic of the sugar tax before we run out of time. I was in Barbados last year, and I was able to speak with representatives of the Ministry of Health, talking about the sugar tax there. We have our close neighbor Mexico, who has instituted the sugar tax, and they have seen positive results so far. What has been, I know PAHO has also been advocating as well in other countries that they look at the possibilities. Where does Belize fit in on the possibility of instituting a sugar tax, and why? It's difficult to have people understand. People love their sweetened beverages. We have I remember the nutritionist saying Belizeans have a sweet palate, and our first preference will be what has the sugar. So has it worked? Is it possible in Belize? And is it something that we're looking at in the long term?
I think it's on the table for discussion, actually, and I think I heard in the previous segment something about taxing certain food items.
Yeah.
I think it's a good investment, one, because it makes it more difficult for the population to access something that's negative for them. I think that's where the state has a responsibility to make those kind of decisions. I mean, to protect the population sometimes from themselves. Yeah. I think those are hard decisions that need to be made. And then I think in the Caribbean, Barbados and Mexico, there's been Dominica as well. They've had it's been done, and I think there's good results. So there's enough information to show and to convince us that that's one of the things that we should do.
And last week in Guyana, I was speaking to Minister of Finance, and they were saying, and the Prime Minister, that you need also a public education, arm to this, so people understand why the government is doing this. So I came to Dominica and I was talking about putting taxes on sugary beverages, and then the following 2 weeks, the budget address talked about that. But I had created the environment for that.
Okay. And my last point before we wrap up, because I think it is worthwhile to perhaps discuss a bit, is looking at how PAHO and the respective Ministry of Health, but especially from the regional level, we have seen continuously for the past couple of years new and emerging diseases entering into our region, many of which we've been very ill prepared for, simply because I suppose we underestimate the rate as to which diseases can move now. How do you now, given the experience that we've had with Zika, Ebola, chikungunya, now plan for what may potentially and most likely will come in the future?
Okay, so I think that Zika and chikungunya progressed at the rate not because we were ill prepared. I think we had poor vector control. But what we are doing under the international health regulations, we have national focal points. Countries are helped to reach what is called the core capacities for detecting, for responding, and for recovering from these illnesses. There is a very strong surveillance system throughout the Caribbean and throughout the region, and this is very, very important because you need to detect as early as possible. And we have the collaborative approaches. So we have regional labs that respond to the entire region. We also have a group of experts who form the GORN, as we call them, that we can call on immediately, and they will respond. So we don't only depend on the expertise that is available at the country level, but we have a regional expertise that we can bring to bear. And I think we do very well in the region. I mean, you can't stop some of these diseases from coming to your shores. In particular for Zika and chikungunya, our problem was poor vector control. And this is an area that we are striving for. At one time, this region was free of the Aedes aegypti mosquito, but it has come back, and because we've not pursued vector control, but even now we are seeing resistance to some of these insecticides, and so we need to look for innovative ways to ensure that we can do vector control.
Just recently, and based on the advent of these new diseases coming up and the quick spread of it, with PAHO's assistance, there was a joint evaluation exercise that assessed our core capacities, Belize's response and preparation in terms of the international health regulations and the 19 core capacities, to assess where we have gaps. And so we will, and part of the country cooperation strategy, the number 4 priority, is to see how they can help us strengthen and address those gaps. So there are a couple of issues there that we need to work on. One of the things that we are facing worldwide, they're facing is the resistance to antibiotics. And I think in Belize that's one of our weak areas. We don't have a good system to be able to detect and monitor that. So we need to work on those things. But yes, it's on the table.
And we're doing that throughout the region, all of the countries of the region.
Okay. Well, I want to say thank you for joining us this morning, and Dr. Etienne, I hope you have had a very productive visit here in Belize. Anything that you would like to say in terms of observations from your visit, and perhaps areas that seem very optimistic after your interactions?
No, certainly I think Belize is on the right path to universal health coverage. I believe that you are doing very well for malaria. You are in the pre-elimination phase. I think that you have a very good immunization program. You have eliminated measles, rubella congenital syndrome. I believe that you continue to build on the expansion of care as well, and the availability. So we are hopeful. We are hopeful that Belize will have the successes as far as our health for all. And my last word is health is everybody's business, really. Don't wait for the government. Every family, every individual, every community, private sector, all of government needs to become involved, because health is an investment for development.
All right. Well, thank you very much for being here. We're going to go ahead and take a break. When we come back, we're actually continuing our conversation about healthcare, this time with regional sales from Health City, Cayman Island. We'll have that after the break. Stay tuned.